Hello, my friends. This is Dr. Diana's patient, and I am pretty ill. I wanted to address a huge center of confusion for many patients and doctors that I think needs to be brought forward. The big question is POTS the same thing as dysautonomia? I know that when I was diagnosed with POTS, I also had severe gastroparesis, no ability to control my temperature, constipation. I felt like I was flooded with adrenaline. I had hand tremors and the inability to sleep. I was diagnosed with hyperadrenergic POTS. My heart rate increased over 30 beats per minute on a tilt table test, and my norepinephrine levels when standing were abnormally high. Now, in my mind, POTS, being postural orthostatic tachycardia syndrome, was indeed a syndrome, which must have included other symptoms of autonomic dysfunction. This was how we discussed our symptoms and signs on the forums, and the doctors ignored those other signs and symptoms frequently. Now, in my mind, POTS was a syndrome, meaning it occurred in conjunction with other signs and symptoms, or else they would have called it postural orthostatic tachycardia sign, right? Wrong. I've come to learn that most doctors, especially cardiologists, are focusing only on the increase in heart rate upon standing. Now, as patients, we know it involves much more than that, right? I think it is crucial for us to eliminate this view, and if we have other symptoms of autonomic dysfunction, to substitute the word dysautonomia, which includes POTS and crazy changes in our heart rates and blood pressure for POTS. I remember many doctors focusing on my heart rate change when I told them that sign was the least of my worries. In fact, I went through every beta blocker made, and they may have made the doctors feel better because my heart rate was slower, but I actually became sicker. Now, I believe it's essential for us all to use surgical precision when discussing our condition to put a halt to this source of confusion. If POTS were our only problem, we wouldn't continue to feel so ill even when we're laying down, right? Now, as you know from the Driscoll theory, we have a plethora of comorbid conditions that can continue down a terrible slide if they're not arrested properly. Now, I'm revising part 2 of the Driscoll theory now for you so as not to perpetuate this point of confusion. We must all get our doctors on board with the understanding that, especially with Ehlers-Danlos syndrome, our problems extend way beyond heart rate and sometimes blood pressure problems. Does that make sense to everyone? So I will make every effort to use the word dysautonomia, or at a minimum, I'll use the phrase POTS dysautonomia in my writing and communication from here on out. If we can get all doctors and researchers to understand that we have a syndrome of multiple signs and symptoms of autonomic dysfunction, that will be a huge step forward for us all. So, who's with me? Oh, until next time, my friends, let's continue to change our world one brain cell at a time if we have to. Gentle hugs to you all.